Yes.
Can OTs use this
Um,
when commenting
no.
on mental and behavioral disorders?
My opinion is no, that OT should refrain from doing so. And the basic reason is that very similar to what we discussed in the GOS. When I give a GOS category of 3 or 4 marked, I have to be certain that it's based upon strictly the brain injury related impairments. So as an OT doesn't know what the diagnosing clinician is going to diagnose. And the OT doesn't know, even if they know the diagnosis, whether it's going to be conclusive relative to whether it's motor vehicle accident related or not. So without that diagnostic ability and ability to look at the causality piece, I feel that OT should not be rendering an opinion in terms of which category a person falls into. That having been said, we have what I think is a really important contribution of OTs and how OTs can set up the reports to be very helpful to the diagnosing clinician in driving this opinion. Because we can talk about what the diagnosis is, we can comment on material contribution, but on the other end, in terms of the functional impairments, we're not there. We can't draw that line between these functional impairments are related to the MSK, these functional impairments are relative to the hemipresis, these are related to the cognitive, which is grounded in either organic or an non-organic basis.
So I've seen CAD assessment reports where the OTs actually have used
Yes.
commenting on 4 areas.
Yes.
I'm going to go into later.
The OTs need to comment on the 4 domains,
Right.
but they shouldn't be doing that in my view.
And then 2 weeks ago, I got a report from a lawyer asking me to review a CAD report because the OT did not use this. And
Okay.
wanted you to rate it.
Okay.
Report and rate it.
Okay.
I didn't end up doing it.
Right.
For all.
So now you can go back to them. Well, you probably won't go back now because you're going to say the same thing you said originally, just with a little bit more force. But no, you were right to take that position. Absolutely. And I would even argue that because these assessments are so much more comprehensive and refined in scope, it's going to be almost impossible to take somebody else's data, because most OTs out there are not going to be giving the level of refinement for you even to classify this way, let alone for the diagnosing clinician to be able to tease out what should be put into this classification mix or not. So I think you're very strong footing to basically insist that you do your own assessment.
So then if you have an OT report, you just want them to comment specifically on the domains of what they found and their objective findings, so then you can take that information to classify it.
That's right. And I'll show you an exact example, and you actually have it in your handout materials in terms of how it should be set up to really facilitate it for the diagnosing clinician.